Okay, before we go deep into our discussion, we need to know what is Sustainable Development Goals, the goal we chose, and the program that we chose for that goal. Firstly, Sustainable Development or SDG is the blueprint for a stronger and more prosperous world for all. We need to synchronize the goals for world to being the better place for human being, so that all the nations will be together in achieving the goals. Secondly, the chosen goals is good health and well-being by ensuring healthy lives and promote well-being for everyone at all ages. As we know, not everyone in this world get the access or chances for good health, so we need to be together in giving the chance to them. Thirdly, the chosen program is vaccination and oral health education program for refugee children. It is being organized by Malaysia to implement health programs in increasing their level of health.
From 26 August 2016 to January 2017, the Mercy Project went to 3 different schools in Klang, which are Harmony School and Al-Ihsan School in Selayang, as well as St. Mary Agib School in Ampang, to organize vaccine clinics and oral health education for the BINTI series. This school provide educations for refugee students. The program involved the distributions of free vaccine care to refugee children under the age of 18 in Klang. They have been classified as those that have not received penticillin and MMR vaccine that will protect them from disease such as diphtheria, tetanus, and also polio. There are 230 refugee children that have received the penticillin and MMR vaccinations and received health oral hygiene education.
What the goal to achieve? The objective or goal of the vaccination and oral health education program for refugee children is to provide catch-up vaccination for refugee children under the age of 18. Currently in Malaysia, there are more than 100,000 refugees. They have fled home in need of temporary accommodation or permanent shelter from the conflict and instability in different areas around the world. This vaccine saves the life of up to 3 million people per year. They are also protecting those around us when they get vaccinated, not just protecting themselves. A person is vaccinated against a disease, their risk of infection is often reduced so that they are much less likely to spread the disease to others. As more people in the population become vaccinated, less people remain exposed and there is less potential for the pathogen to be passed from person to person, lowering the risk for a pathogen to circulate in the population prevent those that cannot be vaccinated against a vaccine-targeted disease due to other severe health conditions.
To make this program a success, several methods have been adopted to ensure the success of this program, such as choosing 3 schools in the center of Malaysia to easily facilitate and launch this program. In addition, Mercy used the data about refugee children from NUHCR to collect the actual data about them for giving the vaccine. Public also as volunteers come and join Mercy together in order to run this program.
The equipment or materials that be used by Mercy Malaysia in this program. Mercy Malaysia is one of the few NGO in Malaysia that run vaccination outreach clinics because of the complex requirement for the vaccine storage and cold chain process, the associated expenses, and thus the complicated patient data management involved. Mercy Malaysia is fortunate to be the first reception in Malaysia to receive a technologically advanced vaccine refrigerator, which was donated by True Energy, an organization based in Wales, United Kingdom. Furthermore, Mercy Malaysia, in close collaboration with the Dhaka Community Hospital, initiated the health and hygiene education program within the hope of lowering the incidence of diarrhea disease among the beneficiaries. Quite the topics covered during the education program was rainwater use, preventions of diarrhea, personal hygiene, and birth preparedness. Supplementing the education program, each family representative also received a gaggle of hygiene items like soap, hygiene kit bag, washing detergent, mop, toothbrush, toothpaste, water pouch, and disinfectant. Moreover, 77 volunteers from various backgrounds were involved in fixing the clinics and conducting basic medical health screening, medical consultation, and distributions of hygiene kits. Last, multiple cases of health issues and illness were detected and mentioned the hospital for further treatment. The availability of primary health care includes general medical checkup for the community and provision of medicine.
Let's study activity to follow. There are two activities of Mercy Malaysia for the vaccination and oral health education program for refugee children. The first activity is, over a period of 6 months in 2016 until 2017, Mercy Malaysia has deployed a team of staff and volunteers to 3 schools in the Klang Valley district, which are Harmony School and Al-Ikhlas School in Selayang, as well as St. Mary Agape School in Ampang, to conduct immunization clinics and oral health training sessions for recipients. This school provide education for refugee students who are primarily refugees from Myanmar. The second activity is testimony by volunteer. According one of medical graduate Atira Mazli, she stated that she volunteered to help the kid, yet she always left the clinic with a renewed sense of hope and life which come from the kid and what they do for their fellow friends and the volunteers.
For sure, to become successful program, Mercy must join together with other parties or operators to involve in this program. The operators involved such as UNHCR as main and legal bodies to receive the data about refugee children. Second, the volunteers from public STR team workers and support this program. And third, the two clinic, which is Human Aid UK and Baby Beyond Clinic Specialist Clinic, in providing information and initial care on oral health, medicine and vaccination to the refugee children.
Malaysia has seen a significant increase in the number of vaccine-preventable disease cases. Firstly, the benefit of vaccination and oral health education program for refugee children is vaccination prevents some of the greatest killers of children under the age of 5 from being killed. Many of these, including diphtheria, are also widespread in camps for refugees, and yet vaccines that can protect children from any of these diseases are available. Secondly, vaccines are one of the most effective global public health interventions ever. The benefits range from longer life expectancy to saving healthcare money to cancer prevention and protection against associated diseases and so much more. Vaccines avoid 2 to 3 million deaths per year. That number may even be higher. By shielding them from a host of diseases, more vaccinated individuals could save another 1.5 million lives per year. Lastly, infectious diseases are one of the biggest threats to the health of refugee children. Immunization can help prevent many life-threatening diseases and prevent the death of children. That means children with weakened immune system are overcrowded, no access to fundamental health services, and no preceding vaccines. Even in the midst of extreme hardship, they work together with immunizations to promote the healthiest atmosphere possible for refugees to live and prosper. Going through suggestion of vaccination and oral health education program for refugee children. First, national childhood immunization. This policy will include assessments of vaccination policies and the inclusion of vaccinations in the program, taking into consideration the burden of local diseases, the protection of vaccines, the efficacy and the cost-effectiveness of vaccines. This means that the national childhood vaccine recommendations are up to date. This initiative would concentrate more on refugee children who have just entered the Malaysian border. Second, NGOs cooperation against no vaccine. The Misi Anak Muda Peduli Rohingya not only donated homes to 100 refugees families, it also delivered food aid and thick blanket to 2,000 recipients as well as 1,000 toys to children. They will help to coordinate a special vaccination program for refugee children living there with the assistance of this NGO.
Okay, from our discussion, we can see that we have great progress against several leading causes of death and disease. Reflecting to our community, health condition and awareness, the government implement various strategies in order to improve their awareness. As individual, we can sign campaign for good health and well-being. And furthermore, we can together lobby for policies to ensure good health. And the next one is we can encourage sustainable medicine production. And after that, we also can support medical practitioners to maintain the genetic diversity of medical treatment. And the last one is we can lobby for investment in a smallholder health institution to increase medical equipment, security and nutrition for tourists.